keep them safe and to be able to hopefully in the future start seeing extended family again. And then also to protect the clients that I see. I mean, they're kids, elementary school, middle school, high school, and I want to do my best to keep them safe. And being with school-based services, I really am just desperately dying to get back to school. And I want to be back in the schools with them. And I feel like that's just the best way in order to keep everybody safe and for us to get back to school. Getting the vaccine is meaningful to me just because it's new and we're looking at protecting everybody and hopefully getting life back to our old normal and not the new normal that we always talk about. It was really exciting to go get it. I did it at the Broadbent Arena, and just the atmosphere in there was really hopeful and excited. It was just really kind of moving and touching to drive in there and to see all the volunteers and people just wanting to help out. And I think that was really cool and a very special moment for me. Side effects, I felt a headache and I felt tired. I wouldn't say I was any more tired though than if like my child wasn't sleeping through the night or something like that because I have young kids. So I wasn't really that tired, and really by the next day I felt pretty much back to normal within 24 hours. My arm was a little tender in the morning. But by that afternoon, I was back to feeling like myself again. What I would tell people that are feeling hesitant about the vaccine is to one, like just talk to people that have had it done. What are your concerns? What are your biggest fears? Is it how you're going to feel afterwards? Is it what do you think is going to happen? Talk with your doctor. I think that's another big one, is to look at doctors and do your own research. There's so much research out there that I read about the benefits that could happen and how we could really help each other and kind of get closer to having our lives back to our old normal. And so just doing it that way, talk with people that have had it. And again, looking at their concerns or how they felt afterwards. For me, the biggest thing was just, I would much rather get a little bit, have a little bit of reaction and side effects to it versus kind of the horror stories that we hear of people getting COVID. I have no family that have gotten it. I have friends of family that have lost their family members and their loved ones to it, people that are healthy or have been healthy. It's not just always affecting this older generation that we talk about, but just really thinking about, I have a friend whose husband passed away and because of COVID, and he was young and active, and I just didn't want that to happen to anyone in my family. And I want to be able to see my extended family again. I haven't seen my grandfather in over a year, and he's in his 90s, and I didn't want anything to happen to him if I happen to be exposed or my kids have been exposed. So we haven't seen him, and I just want to get life back. So really, again, if you're feeling hesitant, just talk to people that have gotten it. Look at research, talk to your doctor if you've got some kind of health condition that you think may limit you from getting it, and kind of go from there.